Retiring early. What to do about healthcare for the gap years. Hi, I'm Dave Grant. I'm a certified financial planner and the founder of Retirement Matters, a financial planning company based in Barrington, Illinois. Planning for health insurance through the time you become eligible for Medicare was thought to be fairly straightforward. You utilize your employer's health insurance plan, or your spouse's, until you retire age 65, and then you file for Medicare. However, whether you've always planned on retiring early or early retirement is forced upon you, it may not be as straightforward as you hoped. Filling the health insurance gap between the time your job-based coverage ends and your Medicare eligibility is a critical part of your transition into retirement. Fortunately, you have several options to cover your health insurance gap years, but timing is of the essence. You will need to quickly assess your options in light of your financial situation to determine which one can provide you with the optimum coverage at a reasonable price. Spousal coverage. If you're married and your spouse expects to work for a period of time, the first place to look, and often your best option, is your spouse's health insurance plan. If you're eligible to join on this plan, it will likely be the best coverage you can get for the cost. Although your overall premiums will likely increase by adding you to the plan, they will still be lower than most of the alternatives. One of those alternatives is COBRA coverage. By law, you are able to stay with your former employer's health insurance after you retire or laid off under COBRA coverage. Now, this is great if you like your existing coverage and you want to be able to keep your providers. The bad news is that you're going to see a sharp increase in the amount of premiums that you're going to pay. Also, COBRA only extends your coverage for 18 months, which means that if you're short of Medicare eligibility by a number of years, you're still going to be facing another gap. The public marketplace. At least for the moment, the public marketplace established by the Affordable Care Act is still in place, and it offers plan options for anyone not yet eligible for Medicare. This is the place to look if you've got some pre-existing conditions, because under ACA, you can't be denied coverage, and they can't impact your premium beyond certain limits. Now, if you can qualify, then you can also get government-provided subsidies to help cover the premiums. Your next option is private insurance. Your best option for finding the type of coverage you want is through private insurers. However, it's also going to be the most expensive option. If you can afford to shell out a higher premium for a few years, you can find a plan with a reasonable copay and deductible. If a higher premium is not in your budget, you can explore the use of a health savings account, or an HSA. An HSA is similar to an IRA that it allows for before-tax contributions and tax-free earnings, and then that can be used to pay for eligible medical expenses. Now, to qualify, an HSA must also be used with a high-deductible health insurance plan. The idea is to use your HSA account to cover the copays and deductibles that the insurance plan is there. Most likely is for catastrophic coverage. Now, some people, when they retire, they only need a short-term amount of coverage. So if your insurance gap is less than a year, you can look into short-term health insurance. It's designed to cover most medical expenses, including emergency room visits, and most inpatient and outpatient hospital care. Now, whichever option works best for you, don't forget your supplemental coverage for dental, vision, and maybe even critical illness coverage. Now, if these plans are not available through the option you select, they can be purchased separately through other insurance carriers. If you're not sure which option is best for you, why not contact me and we can discuss your situation. Until next time, enjoy the day.